All right, it is 6 o'clock, so we will go ahead and get started. We want to make sure we have time to get through all of our comments and open it up for community questions. So thank you all of our panelists for joining us today. We have a pretty full agenda ahead. We're going to go through some vaccine information and allow our panelists to share their experiences with their own vaccines, followed by some information about COVID vaccines in the Black community specifically. And then we will open it up to community members' questions. So for those watching, if you could, while we're talking or toward the end, put your comments or your questions, in the Facebook comments, and I will make sure our panelists address as many of them as possible when we get to the end. So let's start off. I would love if you all could say your name and your job title before we get started. So we'll have Health Director Jenkins go first.
Good evening to my fellow panelists and to the listening audience. I'm Rod Jenkins, Public Health Director for Durham County. A proud Public Health Director, I will say, because Durham County continues to do well, and we are managing to do what we need to do to keep ourselves safe. So again, thank you so much for being here.
Awesome. Next we have Marissa Mortiboy.
Hi, good evening. I'm glad to be here. Marissa Mortiboy. I'm the Population Health Division Director with the Durham County Department of Public Health. And Population Health is our newest division. We center our work on data and equity to look at outcomes, health outcomes across the population.
Thank you. And Dr. Julius Wilder?
Good evening. It's an honor to be here and share this panel with such an amazing men and women. My name is Julius Wilder. I'm a physician at Duke. I'm an assistant professor of medicine and GI and hepatology. I'm very happy to be here, and I'm really excited about our conversation.
Great, thank you. And Ms. Williams.
Good evening, everyone. My name is Faye Williams. I'm a retired registered nurse. I like to refer to myself as an Aggie nurse. I work at Duke South in the clinic. What we do is we screen patients for COVID symptoms prior to their going to their appointments.
Great, thank you all. So to get us started off today, Rod, I would love to provide an overview of what's going on with vaccines in Durham right now. So could you just give us some background info on who's eligible to be vaccinated and how they can make appointments and where?
Absolutely. Since December 21st, Durham County has been fortunate to have a vaccine, and this life-saving elixir is definitely in full production and also being distributed widely here in Durham County. Unfortunately, it pains me to report that not only is it a global issue, a national issue, but it's also a statewide, local issue that vaccine allocations are very anemic at best. We are looking forward to supply chain issues being resolved, and for the vaccine makers to really honor their commitment, which is to produce 100 million doses to the United States. We are very fortunate to have both vaccines here. We do have Moderna, which was really targeted toward local health departments, because it's it's a little bit more manageable, not really as restrictive when it comes to freezing temperatures that it has to be kept in, but it still has to be kept refrigerated. And then of course we have Pfizer, and that requires ultra cold storage capabilities. At present, we are currently in phase 1 and 2, and soon to be moving into phase 3, which goes into effect next week. I want to say in about 8 days on February 24th. Phase 1, of course, folks like Ms. Williams and Dr. Wilder and Marissa and even Alicia, because we're public health workforce. We work for hospital systems, so we are truly on the front lines. And doctors, nurses, and of course with this being a very fluid situation, they have made some modifications to the phases, and now they're they're calling it groups, phases. They use it interchangeably. However, phase group 2 became slightly problematic for a lot of locations, because that's your seniors who are 65 years of age and older, and that's a wide swath. Of course, it was 75 at first, and then they kind of bumped it down to 65. And again, the key right now is to make sure that we take care of the people who are most at risk and most vulnerable. And we're happy to do it. And at present, the way that you are able to get the vaccine, of course, is if you're eligible, and also if you're able to be scheduled for an appointment. At present, our scheduling has been paused because what I just mentioned, our vaccine supply is very, very low. And, for the most part, when it reopens, you'll be able to book online and to be able to call our COVID vaccine line, which is 919-560-HELP. And I think I'll just wrap up by saying, in the meantime, of course, we have a wait list that has been worked right now. We have a wait list of approximately 3,000 people. But there are other ways that you can get the vaccine. Of course, Duke does have a wait list, but they are still scheduling. Walgreens are scheduling for their own customers who are in phase 1 and phase 2. They will move to phase 3 when North Carolina moves to phase 3 as well. And I think that's all I have for right now. You're on mute.
Thank you so much. You would think after doing 100 of these calls a day, we would no longer have these problems, but that is the beauty of Zoom, is at least you all can see that our mouth is moving.
Dr. Wilder and I are going to go into business and make a shirt. You're on mute. It's going to be a bestseller, I can tell you.
I like it. But you mentioned that the vaccines being offered right now are just Moderna and Pfizer. Is that correct? Awesome. Thank you so much for that background info. Now, one of the reasons we're having this session today, specifically for the Black community, is we are seeing lower vaccination rates in the Black community across the state, but also in Durham as well. And we did a survey earlier in our vaccination process that some of our viewers probably participated in. And to get a sense of people's feelings and concerns about vaccines and if they're excited or not and why or why not. And we saw close to 90% of all Durham residents said, if I had the chance today, I would be vaccinated. But that number dropped to about 70% when looking at the Black respondents in particular, which still, majority want this vaccine, but we do need to look at the ones who don't and say, what can we do to bring that number up to 100? And we asked why, and one of the biggest concerns was safety. People not sure if they should trust this thing that they feel was put together quickly, or not sure about vaccines in general. So we do want to ask our medical providers here if you can kind of share your thoughts on the safety of the vaccines and what people should know. And we'll start with Dr. Wilder. Excuse me, Julius.
Sure. You raise a great point. One of the concerns that folks have had is how quickly we develop this vaccine. Vaccines normally take such a long time. An important thing to keep in mind is that there was a new technology that was leveraged that was not widely used, but around previously, but not widely used like this. And it was a new technology related to mRNA sequencing of the virus, of just parts of the virus, that allowed us to very quickly create the first vaccines that became available, the Moderna and the Pfizer vaccines. And so in terms of why it became available so quickly, how we could do it so quickly, it's not because there was any sort of strange fake vaccine or any sort of plan to create this virus and they had the vaccine ready. No, they were just able to quickly sequence the virus's DNA, leverage the mRNA related to it, and then create an actual vaccine. It is a very safe vaccine. The clinical trials across the world in various different populations have shown over and again that while there are some side effects that may occur with it, they are fairly mild. They last a short period of time and people do fine. Those side effects include things like mild headache, some discomfort in the arm where you got your vaccination. Some folks may have some mild fever as well. Some folks have had some sort of flu-like symptoms in terms of muscle aches. But again, these are all fairly transient symptoms. They're mild. With things like a little ibuprofen, some Tylenol, most folks are fine, within 8 to 12 hours of onset of symptoms. And not everyone experiences any symptoms at all. There's some people who have zero symptoms do perfectly fine. And so it is very, very safe vaccine. And we're lucky that we were able to leverage the technology to create it so quickly.
Great, thank you. Ms. Williams, is there anything you would like to add on to that?
Thank you. And what I share with my patients is that this country has a system in place to assure that the vaccines are safe, and that this vaccine went through clinical trials at close observation and research. And it was a way to determine if the vaccine was safe and effective, and standards were met. There were phases that the vaccine went through before it was released to the public. And we're still monitoring the vaccine for problems and side effects. And because the vaccine is out there now, it doesn't mean that the research has stopped. The vaccine is still being researched to make sure it is safe for consumption.
Great, thank you. So we've gotten, since vaccines started, we've had lots and lots of questions of all shapes and sizes, and we're doing our best to address them all. But one of the questions we're getting a lot is from people who are willing to be vaccinated, but not sure if they should. Sort of a two-part question, actually. The first is, do I still have to be vaccinated if I've already had COVID and recovered? As well as, is it important to still be careful if I have been vaccinated? I've got my 2 shots. Can I start traveling again? Can I start hosting parties again? So Roger, kind of our CDC guidance expert here at the health department. So we'd love if you could take these.
More than happy to. I will say that the answer is yes. If you have had COVID-19, of course, the answer is yes, you still should take the COVID vaccination. For the most part, if you've had, I tend to tell, I tend to be a tad bit blunt in my assessment. And I tell people all the time, you don't want to play around with COVID-19, primarily because some people get a mild cold, some people get a little flu-like symptoms, and some people get a ventilator. So you want to make sure that you understand that COVID-19 is an equal opportunity killer. And as public health director, one of the grim aspects of my job is that I get notified at every time someone passes away from COVID-19. In Durham County, while we're doing well, we have passed a grim milestone of over 202 to be exact, individuals who have died due to COVID-19. Of those 202 individuals, a disproportionate amount are communities of color. So again, I try my best to tell individuals like, look, please take it seriously, get the vaccine. If you've had COVID-19, and if it was mild, of course, you still are encouraged and you can take the vaccine as soon as you are done with your quarantine period. If you had COVID-19 and you were severely ill to where you had to get mononuclear antibodies, then of course we want you to consult with your primary care physician. And then you also, per CDC guidelines, have to wait 90 days prior to partaking in it. That is the CDC guidance that's there. Did I answer the second question?
You did not yet, but you will right now. The second question was, I've gotten my shots. I feel good. Do I still have to be safe? Do I still have to be careful and wear a mask, or can I go out and live my pre-pandemic life yet?
Thank you. No, you can't live your pre-pandemic best life just yet. You, in fact, have to make sure that you see this COVID-19 vaccine as another public health mitigation. You still have to wash your hands. You still have to socially distance. You still have to wear your mask. And I know a lot of people are not too happy about continuing to have to wear the mask. You have to avoid large gatherings, and you certainly can't throw parties and be in, close proximity to a lot of people. You still have to, really practice those public health mitigation strategies that are tried and true, that have truly gotten us this far, until we can get the all clear to where, we have enough people in our society who've been vaccinated. I'm proud to report that there are some pockets of immunity. And I'm also proud to say that Durham's on a downswing in terms of our number of cases. I gave Durham, I quip a lot, but I gave Durham a pass for the holidays because I don't know about you, but Ms. Williams looked like she might be able to cook a nice sweet potato pie.
No.
Not at all. Okay. But I will say, looks can be deceiving. But I will say, I gave Durham a pass because I know the holidays, you want to get close to your grandma, and there's not enough COVID in the world to really stop people, so we give the public health guidance, but people are going to do what they want to do. But I will just say, we saw the highest amount of cases that we saw on record. There was a one day in which we had 300 total cases. So those were some dark days. So I'm proud to say that we're on the downswing. So that's all. I'll kick it back to you, Alicia.
Great, thank you. And again, we will never be able to answer everyone's questions about the vaccine logistics, but afterward, of course, I'll share some resources in the chat for people who have more questions. But we want to move to another question we got a lot on the survey and in the days since, which is, I'm thinking about getting my vaccine, but I really want to know literally, how do I feel after I get the shot? Does it hurt? What was your experience like? What were your symptoms the next day? So everyone on this call is either a medical provider or you're working in person with the vaccination process. So you all by now have gotten your first and your second doses. So would love to hear from everyone, what was your experience like on vaccine day and how did you feel the next day or the next couple of days? So I'm gonna let everybody answer and we will start with, hang on just a second. Ms. Williams, I'll ask you from your perspective, you were the first person in the triangle to get vaccinated. What made you decide to be the first and to share your experience on camera, and how did it feel to be the first and to be able to have that opportunity?
First of all, I knew from the very beginning that I would take the vaccine when it became available. It was purely fate that I was first. I had worked with this person at Duke on another project, and she met me in the hallway on the day that Duke started administering vaccines. And that was on December the 14th. And she approached me and said, Faye, we're going to start giving vaccines today. Would you? And she didn't even get to finish the question before I said, absolutely, I'll do it. I just felt that she was going to ask me to do it. And so she told me where they would be giving the vaccines and told me to meet her there at 2:00. So I went there early. I was excited about it. And when I showed up, she said to me, she said, guess what? You're going to be the first person in the triangle to get the vaccine. And I was confused, but I said, okay. I didn't think it was a big deal. It was me. I take a shot. I go about my business. But I arrived in the room and the room was full of the media. It was full of other health professionals. Everybody was standing around. And they started asking me questions about how it felt to be the first and all that. So this when I started to think this really is a big deal. So anyway, after I took the injection, I talked with the media. And I thought that was a way to get my experience out to a lot of people and to share the importance of getting the vaccine. And so I also knew that people could look at me and see that I was okay. I wanted them to look at me and to also see themselves. I wanted them to hear my experience, what I went through, and ask me questions. And I wanted to be an example. I wanted to do my part. And I also wanted the health system to see that they had invested in the right messenger. And as a result of that, I've had a lot of experiences like I'm having tonight to talk to people about the importance of the vaccine and that it really is okay, that it's safe, and it helps us get on the path of getting back with our families. I had absolutely no concerns about it. No regrets. I still have to remain 6 feet apart. I still have to wash my hands. I still have to wear my mask. I've had both doses. And so to answer your question, it's just been amazing to be in the public eye, to share the experience, and to encourage people to take the vaccine that right now is the best route that we have to getting back to our previous life.
Awesome. And I did get a little order. I do want to hear his side effects and symptoms in a minute, but first I do want to talk a little bit about what motivated you all to get vaccinated. So apologies for a little confusion there, but now Marissa, so we work together, we talk, and you told me previously that you were kind of hesitant to get the vaccine at first, as a lot of people probably are at first. So I'd love to know what kind of made you change your mind, how you feel about the decision now.
Yeah, and so I'd share that. I know I work in public health, but I think a lot of other people that I was just hesitant, as Julius and Faye talked about, the speed of the vaccine was one factor. And so just thinking about how long it takes for medications usually to go through the clinical trials and research, and it takes years. And COVID-19 started in March of 2020 in the US, or really increased. And by November, they had a vaccine. And so, just hear about the trials and the stages. But once I started reading about, the trials and, the safety measures, and that nothing had changed, they weren't cutting any corners. It was just the process moving a lot faster, just because this was a top priority. It's a worldwide pandemic, and resources, funding was being directed towards research and moving the clinical trials through a lot faster than usual. And so that helped a lot. And so once I knew about that, and working at the health department, I had the opportunity. And so first I thought, well, I'm just gonna wait a little bit. I'll just let other people take it, then see how it goes. But once it was my turn, I realized if I take this vaccine, I could protect myself. I could protect others in the community as well, especially those who are more vulnerable. And it released stress too, just because throughout this pandemic, worrying about, am I going to get COVID-19, and am I going to get sick, and how will it impact me, and how will it impact others as well in my life? So just thinking about that. And then one key thing too is my parents, they live in Illinois, and so they're both in the 65 plus age group. And so I knew by taking the vaccine, I'd just be one step closer to be able to see them again. And I think that's the hardest thing. I know it has been for me and other people as well, is not being able to see loved ones. And so by taking this vaccine, I know that that will be a little bit shorter, and we can get back to living our normal lives once more people get the vaccine, and we build up some more immunity in the community.
Great, thank you. I really appreciate the honesty there, because we do work in public health and we're expected to be on the front lines of everything, but we're people and we have the same concerns. So I think it's really helpful for the honesty to be shared. Reminder to people watching, I am seeing your comments, but we are going to get to them at the end. So please hang tight and we will definitely get to them. Who's next? Let's go with Dr. Wilder. Now, you are a professor of medicine at the esteemed Duke University, and I am a Tar Heel, but I have no problem saying it is an excellent research university. So I'll give credit where credit is due. So you're clearly a role model in the medical community here in Durham. Did this weigh into your decision to be vaccinated, or kind of what else went into your decision? How did you feel about it?
It did. For myself, and I imagine many of the folks who I share the panel with tonight, the idea that you could sort of be an example, all right? You could show that you're willing to do this. I'm asking my patients to get vaccinated. I'm asking my community to get vaccinated. It's only right that I step out, and be willing to get vaccinated as well. I was extremely concerned, I think as many people, about the disproportionate burden of this on people of color. And so particularly as a Black physician, it was important that to myself as a Black physician and other individuals in medicine, be sort of role models so that the Black community can see that we were willing to get it, that we were comfortable getting it, and that we were safe, in the setting of getting the vaccination. And honestly, vaccines don't save lives, vaccinations do. And so if we really want to get past this pandemic, and Faye alluded to it, and Marissa did as well, then it becomes really important that we as a community, because Alicia, you asked about when can I live my pre-COVID life. This is going to be constantly an up and down scenario. And as Director Jenkins alluded to, there may be events or holidays that cause, a small bump back up in terms of the numbers. And the more people that we can get vaccinated, especially right now with the numbers as low as they are, is a big step forward in terms of our entire community, but especially the Black community, beginning to stay healthy and beginning to get some semblance of that old life back.
Great, thank you so much. Rod, similar question. You're a health director. You are in the vaccine clinic every day. Anybody who's come through the vaccine clinic is probably seeing your face. So for that reason, you are eligible to get vaccinated as someone who works directly with the process. Wondering if your position as health director kind of weighed into your decision, or what other things went into your decision to be vaccinated?
For me, it was both professional and personal. For professional, of course, I believe in leading by example. There's no way I could, really encourage my staff to get vaccinated and not get vaccinated myself. So it was important for the Marissas of the world to see their health director, roll up the sleeve and go ahead and do it. The data, of course, Marissa and I, we're big data geeks, if you will. And we've seen how COVID-19 has severely impacted our Latinx and our African-American population. But what perplexed me at times was to hear that there was so much hesitancy. And of course, I know about all the reasons, the Tuskegee, eugenics, Henrietta Lacks, it's important to acknowledge that those things happen. But then I also, by virtue of my position, know that I've received calls from Duke, I've received calls from Cape Valley Health System, trying to get African Americans to participate in the clinical trials. So I also know that there was a strong concerted effort to get communities of color. And I'm proud of the 10% of African Americans that participated in both the Pfizer and Moderna clinical trials and are still participating. So, again, I just know that my messages to the Durham community was resoundingly positive about the vaccine. So from a professional standpoint, I definitely needed to happen. Personally, COVID-19 took out my college roommate. COVID-19 took out one of my fraternity brothers. He was the first person in Cumberland County, Fayetteville, North Carolina, to pass away due to COVID-19. So, while I did put on a very steely face and steel resolve, personally, I was hurting inside because some people very close to me, to include some church members, had passed away. And I knew that they passed away because, for the most part, they had pre-existing conditions and, they may not have been protecting themselves like they should. And I just know that this vaccine was one way to protect ourselves and to really, as everyone said, get back to the way that we are used to living. So, those are my reasons. And, again, I am no different than people who are listening in the music in the audience. My mama in South Carolina is like, boy, you crazy. Ain't no way. My sister's like, let me see how that works out for you. And I wanted to show them like nothing's changed, everything's good. And so I'll let you go to the side effects.
Yeah, on that note, I think it's honesty hour right now. We have had both doses. I have had both doses. I felt those side effects, and I know some of you have as well. And people want to know, am I going to be out? Is it worth it? Tell me how you felt. What can I expect? So we'll just go ahead and start with Rod, since he has already kind of led us there. Rod, how were you feeling afterward? Do you think it was worth it?
I do say it was worth it. I consider myself to be a pretty strappy young man, and not so young, but strappy. I will say that, again, I can run with the best of them. I can lift weights with the best of them, but, the side effects were real. You will have some pain at the injection site. You will need to work your arm, whichever arm it is. You will get a slight headache. You may get some body aches. But as Dr. Wilder said, a little ibuprofen, a little Tylenol, constant hydration, some rest, and you'll be fine. I was a little crazy. Got my shot on the 23rd, knowing that I got two beautiful kids that I gotta sometimes play Santa Claus for, and 23rd of December, and Christmas Eve. I don't know how I was able to turn a wrench. I mean, I was like, man, it started to hurt a little bit. So I think probably around 10:30, I said, okay, it's time for me to tap out. Washed up, got a nice hot shower, took a little bit of Tylenol, went to bed, came back Christmas Day feeling brand new. That's the prime dose. The second dose is affectionately known as the boost dose. And the second dose, they call it a boost dose for a reason. And again, this is all information to better prepare you for your decision. But there were a little bit more mild side effects, but a little bit stronger, a little bit more intense. And of course, I took Moderna. So again, same side effects that I experienced with the first one, but a little bit more intense. So, again, did the same thing, warm shower, took a little bit of Tylenol, a little bit more rest. But I would encourage the listening audience, if you can, get that vaccine toward the weekend. And if you can, if you're able to, take a day off or whatever, but I would encourage to get the vaccine toward the weekend or on a weekend so you can have that day to monitor yourself to make sure that you're squared away.
But it was worth it despite the pain, right?
Absolutely worth it.
All right, we're going in backward order. Dr. Wilder, you want to share a little bit about your experiences with the vaccines?
Yeah, the first vaccine, I had the shoulder discomfort. And it was one night that the second night, I had a little bit of a headache that was pretty mild. I took some Tylenol, went to bed, and that was really it. Interesting enough, I actually had essentially no side effects with the second vaccination. So I think in terms of side effects, I was pretty lucky. I didn't have very many side effects at all. I know many people that did have precisely what Director Jenkins is alluding to and what he experienced. And I think the advice he gave is really important. I mean, of course, the Tylenol, the ibuprofen, hydration is really important, but planning ahead. I mean, this is something that you need to do. And so if you're able to strategize and get that shot on a Thursday or a Friday in anticipation of having some time if you need it, because you may not need it, but if you do need it, if you're able to do it that way, that certainly is ideal. But yeah, honestly, I did not have very many side effects. I was lucky.
Awesome, that's really good to hear. Ms. Williams.
I think it varies from person to person. After I got my first injection, I had a sore arm. I took it in my left arm because I'm left-handed, and I was more apt to use that arm and move it about. After the second dose, on the second day, I remember having body aches, and I came home. I worked the next day. I had some body aches, and I came home. I took Motrin, and I got into bed, just laid down and got some rest. And by dinner time, it was gone. So I feel that I've been very fortunate, and I did not have any headaches, no nausea, nothing like that. So I think for the 65 and older, I did pretty good. I didn't have, I go on record to say it was a good experience and I would do it all over again.
Absolutely. And last but not least, Marissa, tell us about your experience.
Yeah, so I think I'm with everyone else that it was definitely worth it and I would do it again. So I had my first dose of the Pfizer vaccine in mid-January. And so like Ms. Williams, I had a sore arm. It was probably about 24 hours. I couldn't sleep on my arm that night. It was in my left arm. And then my second dose was just under 2 weeks ago. And so I had it on a Thursday afternoon. And so it was towards the end of the week. And I was, readying myself for the side effects. I was fine that afternoon, and it was the next day. It was Friday morning, late morning. I started feeling like a cold was coming on, just kind of achy and just not feeling well, and got a sore throat in that afternoon, a slight headache, and I just felt really tired. And so I was working from home that day. So I sat on the couch, continued to work. At about 7:30, 8 o'clock, the symptoms had gone away, and so I was feeling better by then. I'd taken some ibuprofen. Drank water, just rested and just made sure that I was taking care of myself. And I was fine later that night. The next day, felt great, and I just went about my day.
Awesome. So what I'm hearing is you might feel perfect, you might feel like you were hit with a bus, but all of it is better than feeling like you have coronavirus. Is that right? All right. Thank you all so much for sharing your experiences. So we're going to shift gears a little bit to get to kind of the message of the evening is COVID vaccines, specifically in the Black community in particular. So as I mentioned, we are seeing, mostly willingness to be vaccinated, but slightly less so for the Black community. So have questions for each of you again. So Rod, if you could quickly talk us through, I mentioned disparities exist, but could you tell us a little bit more about what the data are showing here in Durham, specifically about COVID rates and vaccination rates? And we launched our awesome dashboard today. So I'll also ask Marissa to take us through the data a little bit, but based on what we know, why are vaccines important for the Black community specifically right now?
I would just say that they're extremely important. Number one, because that is the best way for us to protect ourselves. I think Marissa said it best. I mean, just knowing that you're vaccinated and still, practicing those public health mitigation strategies, allows us to be able to turn this corner. And most importantly, allows you to just really work and operate a little bit more with a little bit more confidence, because you know that you've been vaccinated, you've done what you're supposed to do, and you're still doing what you're supposed to do. Durham is from a data perspective, Durham, so proud of Durham. Again, Blacks have been proportionally represented throughout the pandemic in terms of our vaccination rate. You all know that Blacks represent 37% of Durham's population. And our vaccination rate, our COVID infection rate in the Black community has hovered in the 30s, has been as low as the 20s, but it's kind of stayed right there. So even though it stayed right there, we do know that Blacks are, just genetically predispositioned to really be affected by COVID-19. So even though it's been proportionally represented, when Blacks got COVID-19, it's not been a good thing. Particularly, we've seen a lot of Black folks inside long-term care facilities to really be negatively impacted by COVID-19. Congregate facilities, small spaces, and just really telling you from my personal experience, totally gowned up, totally goggled up in 95, went to a couple of facilities, and the site was grim. We were just there just to offer some best practices to really help them to mitigate, and I saw a lot of people of color. So with that being said, as I've said previously, you know who's being negatively impacted, but you're not seeing them, really strongly coming toward, COVID vaccination events, not really trying to beat down the door to get the vaccines. So of course it's due to some fear, some ideas about what the vaccine's going to do to you. So again, forums like this is good. I'll wrap up by saying we're doing extremely well in terms of how we're doing in Durham as compared to the state averages. We're beating the state. For the most part, state African American utilization rate is much lower than Durham. And then it's also extends itself to other demographics. The only demographic Durham is behind, believe it or not, is in the white population, whereas the state's average is much higher than Durham's in the white population. So that just means that we're messaging right, we're vaccinating correctly, and we're doing all that we can to make sure that the Black community understands that this is a vaccine you can trust.
Thank you, Rod. And I'm going to go a little out of order from what I prepared you all for, because Rod has started talking about data. And today, for those who kind of are following us on social or saw on the news, we launched our data dashboard for our vaccine data, which shows vaccination rates across Durham, but also specifically for the Black community. So I would love, Marissa, you are population health director, and you played a very large role in getting that stood up. So I'd love if you could talk a little bit about what you'll see on this dashboard and what kind of data are telling us. Rod touched on it a little, but if there's anything you want to add about that.
Yeah, and I just want to give credit to epidemiologist Dr. Kristen Naney, and then we also worked with our county IT as well. And so we worked together last several days. And so we knew this is something that we've been getting questions about from our partners and community members as well. Who's getting vaccinated? Is it equitable? What does it look like? And so we have the vaccine dashboard. So if you go to our Durham County Coronavirus Data Hub, there's a link at the top. So you click on a button and it takes you directly to the vaccine dashboard. And so the vaccine dashboard displays what group we're currently in, currently vaccinated groups 1 and 2, and how many doses have been given out. So I just want to share that this data is through January 27th. It is data from the state. So that's where the source of it is. And so we're waiting to get more updated data, but we thought it was important to get the information out as well, and with the data that we had. And so this data covers Durham County residents who have gotten the vaccine in Durham County. And so there have been over 24,000 vaccines through January the 27th. And so we show what percent of the population has been covered by dose 1 and dose 2. So dose 1 is about 6% of the total population and a little under 2% for dose 2. And we also show that vaccine sites, so with Walgreens, the Duke sites, Health Department site as well. And so, this is interactive, so you can click on the different parts of the dashboard and the data will actually change according to the sites as well. And we also have the all important demographic information. And so that's what people have been asking most about, is who's getting who's getting vaccinated. So we have it by race and ethnicity. We also have by age and gender as well. And so there are disparities in who's being vaccinated to this point. And so it's been a lot of the white population, Black African Americans, followed by Asian, and then other racial categories as well. And so we want to make sure that that data was available to the public. And so I'm huge on data, as Rod said, that we're data nerds, and so having data is really important because that informs your policies. It informs how you're going to address the issues as well. As we saw this over the summer with our data hub, that about 70% of cases were in the Hispanic and Latinx community. And so we saw that, we partnered to address that, and those rates have come down and are nearly proportional with the population. And so that's why we feel it's important to have this data. And so just encourage people to go to the vaccine dashboard. We'll have new data in the coming weeks, and our plan is to update it at least on a weekly basis.
Great, thank you. And I posted the link to the vaccine page of our data dashboard in the chat on Facebook. So hopefully you all can check that out. I have a question for Dr. Wilder and maybe for Rod, a kind of a specific question. So we are looking at data, but we also are in the clinic every day and we can see who's walking in. And we have seen from both data and from our own eyes that we have a lot more Black women coming in than Black men. We would love to hear from you as a Black man, Dr. Wilder. What is your message to Black men? What would you say are challenges for this group in particular? And what would you say to encourage people?
So, unfortunately, a lot of what we've seen, generally speaking, with COVID is representative of what we've seen in this country across the board, right? I mean, the disparities that we're seeing is because COVID took advantage of the social determinants of health that already existed. So when we think about Black men and COVID vaccination, unfortunately, we're seeing something play out that we see, generally speaking, with respect to Black men and their health. Oftentimes not as engaged and in terms of engaging, getting the health care that they need. And there are a number of reasons why that might be. But I believe it's those same mechanisms that we see driving higher rates of colon cancer because not getting screened, higher rates of heart attacks because of not being managed for cardiovascular disease, higher rates of diabetes because they aren't being screened. Those same mechanisms of us not engaged in the healthcare system are probably a major contributor. And then add that the fact that men, quite frankly, we're just an inferior species in comparison to women. And so we don't live as long, we don't take as good care of ourselves. And so being a Black man on top of that, add the distrust that we may have in this vaccine. It's just the perfect storm, just like the pandemic was, right? To hurt communities of color, especially Black men, for the very reasons I discussed. They're probably the most vulnerable. And I think what we need to do is have Black men at the forefront of these conversations, showing that we got the vaccination, ensuring that our messaging includes people like them so they feel comfortable and see that we're willing to do it. We need to engage Black men in the community so they can tell us the best way to talk to them and stop assuming that we know the best way to do it. And then begin to ensure that we make the vaccine available in those places where Black men are. And so think about how we can engage community resources, community influencers. What do you think about barbershops? What do you think about community centers? There are ways that we probably need to get a little more creative about in terms of how we engage Black men to get vaccinated.
Awesome. Thank you, Dr. Wilder. Rod, we are running a little low on time, but if you have quick stuff we would like to add, that would be awesome. Nope.
I just echo everything he's saying. Like a lot of things, females got to drag us, to the doctor. You got to drag us here and force us to do all this other stuff. And unfortunately, COVID is no different. I think it's close to 2 to 1 for every one male. There's probably like 2 females who've already gotten vaccinated, and that's unfortunate. But I totally agree with what he's saying. We got to meet, Black men where they are, and have these frank conversations and really, if at all possible, possibly take the vaccine on the road to them in order for them to really embrace it and understand that this is something that's going to help you, not harm you.
Awesome. Thank you, Rod. While we're on the subject sort of specific vaccination groups and specific demographics, Ms. Williams, you are not a Black man, but Ms. Williams, you are a senior, and we are seeing our seniors come in, perhaps not at the rate that we would like. And we know a lot of that is access. We've been able to figure that out. But for our seniors who are kind of hesitant, could you talk more about your message to them and your experience, of course, recognizing that this is not just a hesitance thing, this is access, but we'd love to see to hear your comments on for our senior populations.
Because of our age, we are more likely to have other conditions such as high blood pressure, diabetes, lung disease, or heart disease. And so it's very important that we get this vaccine because we are more likely, because of these conditions, to become very sick or to die as a result of COVID. And what I think is most important too is the community involvement, like we're doing today, like we're doing in the church. I know specifically in our church, the population is older. A lot of them, and we have educational forums and conversations with the congregations about the importance of taking the vaccine and how if we want to get back to doing the things we were doing prior to COVID-19, that it's important to get the vaccine. And just like the gentleman was saying before, we have to meet seniors as well as to where they are and have a conversation that they can understand and to answer their questions and do what we're doing today, be very frank with them about the pros and the cons and the hopeful outcomes of getting the vaccine.
Thank you so much. Marissa, I'm going to give you our last question before we go to our questions from our audience here. You are population health director, as we discussed, but you have also been in charge of Partnership for a Healthy Durham, which does our community health assessments. And one of the priorities identified by the assessment is access to care, access to medical care. So we'd love to hear your thoughts on ways that access issues might be affecting vaccination rates in the Black community, and kind of what are some actions you'd encourage from us as providers and as well as from community members.
Yeah, so the disparities we've seen, I think this has been mentioned, they're nothing new. They were pre-COVID, especially hitting the Black community because of structural factors. It's not just about, hesitancy, but it's systemic factors as well. And so looking at transportation and people with issues for transportation, are people able to get to, the health department and get to clinical sites as well. And so just some things that providers and that we can do as well is going to the community. I know there's been talks about this. I know Rod's been talking with partners, but going to the community, partnering with churches, community centers, nonprofit organizations. And so I know everyone knows Durham is a special place, but we have a lot of assets. We have people who pull together when something happens, and we've been doing that during COVID too. So many nonprofits, organizations, partners have come together to really help the community. But partnering and getting the vaccine into community locations, and also as a community meeting and just access to information as well. A lot of people don't have access to information if they don't have internet or have slow internet as well. So different populations may not have access. A lot of people get information through word of mouth. So how do we work with trusted people in the community, our community health workers, our faith leaders, are leaders of well-known nonprofits that are established? How do we work with them to get that information out on a person-to-person level, and making sure that it's accurate information as well, because people are hearing a lot of rumors and a lot of different things. We want to make sure that people have accurate information so they can make the best decisions for themselves. And just thinking about the digital divide as well. So how do we help people get access to tablets, devices, and once they do have access, how do we, ensure that we need them? And there's a lot of groups out there. Partnership for Seniors and More is really looking at this, working with a lot of groups as well, but really looking at those type of systemic issues, and just, acknowledging the mistrust that's happened. And Rod had mentioned this as well. And so just, being honest about that, what we're doing to address that, and also reliable information, making sure that it's available. We're really getting it out to people, because during COVID, unfortunately, we can't really be face-to-face as we would normally when something like this happens. And so things are online and available electronically. So we still have to push to make sure that it's accessible, and in other languages as well, because we have people, refugees and people from different countries, and making sure that this information is available in different languages. So I think looking at the systemic factors, using the assets that we have in Durham to address these, and really working together on this.
Awesome. We will go ahead and start questions. I don't know that we'll get to everybody's question, but we'll try to get through as many as possible, and then we'll ask for a final comment. So the first, I'm going to go in the order that the questions were received on our chat. Our first is not a question, it just says Aggie Pride. So thank you, Ms. Williams. But our first actual question says, the Johnson & Johnson vaccine is less effective than Pfizer or Moderna, but it is more effective than flu vaccines. I'm leaning toward J&J because only requires one shot. Do any of the panelists have insights I should consider before I confirm this decision? Who wants to take that one?
I'll start off by, I'll start it off and warm it up and let Dr. Wilder finish it off. But to that responder, I'll just say, hey, thank you for the question. And I think it's important to remember that if J&J presented itself about a month and a half, 2 months ago, you'd be beating down the door to get it. So again, 70% is good. It's not 95%, but again, the advantage is the one-shot deal. And it's also important to remember that the vaccine is yet another strategy in the public health mitigation efforts. So you could very well take that J&J and be done with it and make sure that you continue to mask up, avoid large gatherings, and wash your hands and social distance. But for the most part, there's nothing wrong with the J&J. It's there. It's another tool inside our toolkit to protect ourselves. And I'll now pass it on to Dr. Wilder.
Yeah, no, I think that Director Jenkins really hit the nail on the head with that. The decision of sort of the one shot versus the two shot, it's not going to really change, very broadly speaking, the fact that we're going to need to maintain for a good while these other mitigations around social distancing. So in my head, 70% is great. If I can get a 90, if I can get a 95%, I'll take it. Knowing that my life is not going to be terribly different in the next 30 days anyway, knowing that I'm going to get side effects with that first shot if it's a one shot. When I think about some of the potential sort of downfalls or negative aspects of the second dose, I just don't know that it makes that big a difference. I think the real benefit of the Johnson & Johnson is going to be where it can be applied. So, we're going to see where that vaccine is available and how it's distributed. We need to be sort of strategic about that. We get it really focused on those communities where we may have a hard time getting people back for the second shot. And so I think that'll be something that down the road, we think more about. But honestly, if you can get a shot, get the shot, please.
Okay, we'll go to the next question. We've gotten a few different versions of this question, so I'll kind of abbreviate it. Lots of people have reservations about long-term side effects. What are the panelists' thoughts of potential long-term side effects of the vaccine?
I'm saying I can start with that. So this same technology for the Moderna and Pfizer vaccines has been used for other vaccines. And so in the setting of that, we do have some data. We are still studying it. There are no anticipated long-term side effects that we see. Interestingly enough, I suspect that in the next 3 to 5 years, having COVID, the actual infection, will be a comorbidity. As we learn more and more about what it means to have the virus, it becomes clear that there may be long-term effects to consider. And so I would say that there is no evidence that there's going to be any concerning outcome long-term from the vaccine, and that we really should be thinking about COVID-19 infection as a comorbidity to be dealt with long-term, and we're just beginning to understand that.
Awesome. Another sort of medical question here, Dr. Wilder, Ms. Williams want to weigh in. Is it safe for people with serious chronic conditions? And they list a few examples like stroke and hypertension, end-stage renal disease. We've also gotten this question about diabetes, cancer, and things like that. And asthma is another common one.
I'll go first to take the simple answer to that. The patients that talk to me about that have other illnesses such as you've mentioned, we refer them to their primary care doctor, to talk to their primary care doctor to get advice as to whether they should get the vaccine. Most of the time they are encouraged to get the vaccine because of these underlying diseases. They are more apt to have a better fight by getting the vaccine, but by all means, talk to your primary care doctor.
Thank you.
Yeah, she's absolutely right. And in fact, the people, what you're describing, should they get the vaccine because of the concern about how sick the vaccine is, the people with diabetes and high blood pressure and obesity and heart disease are the ones more likely to die from COVID-19 if they get it. And so they absolutely should talk to their PCP and are certainly encouraged to get it because they're more likely to have a negative outcome if they were to get COVID-19.
Great, thank you. Another sort of repeat question we have in the comments right now is about these variants of COVID. So one version of that question is the vaccine effective for these variants? And also just kind of, can you talk about it, as the news today says, someone who already had COVID was reinfected with a new variant of it. So anything you could add to that question or that comment? I feel like we're calling on you a lot here, Ms. Williams and Dr. Wilder, as our medical experts. So we're so glad to have you on the panels today.
Yeah, it's fine. Yeah, you know, the variants, there are a couple of variants out there that we're beginning to see. There's a South African variant. The first one that popped up that everyone knew about was the UK variant. There's actually one in South America, Brazilian as well. And the thing about it is that when people talk about immunity or herd immunity, it's really important to get people vaccinated and to social distance because viruses need to be in people to replicate and live. And it's that living inside of people and replication that leads to the mutations that drive the variants. So everyone should get vaccinated to decrease the burden of the virus in our community. So it's less likely that the virus has an opportunity to create these variants. That having been said, the current vaccines we have are effective against the variants that exist. The South African one, there may be some lower, effect, like in terms of how effective it is. I haven't seen the data for exactly what the numbers look like. But remember, we're starting in the 95% range anyway. And so we're still going to be okay. And it's still, without question, even this thing of the variants encourage that people should get the vaccination, because even if it's not as strong, the likelihood of you having a really negative health outcome, getting really, really sick, is still going to be less if you've been vaccinated, even if it's a variant.
Mhm.
Ms. Williams or anyone else, did you have anything to add to that?
I totally agree. And I just try to simplify with my patients by telling them you have an extra tool in the basket by being vaccinated. Should you get the variant, you may not get as sick because you have been vaccinated.
And I just say I agree. Viruses mutate all the time, but that's why there's such a strong impetus to get everybody vaccinated, because as Dr. Wilder said, the more people who are vaccinated, the virus just doesn't have anywhere to go. So again, it's sort of a race because we know these variants are out there. We know that they're going to continue to mutate, but we want to make sure that we get as many people vaccinated as possible.
Great, thank you. We have one non-medical question here. It's kind of vaccine logistics, so I'll combine the two. There's one that asks if an individual can get vaccinated wherever they can get an appointment. I assume that means if I don't live in Durham, can I come here or go elsewhere? As well as one that I'll let Marissa take. If a Durham resident receives a vaccine in another county, will they be counted in Durham or the county they received the vaccine? Marissa, do you want to take that? I kind of put you on the spot there.
Nope, not a problem. So as of right now, the data that we have on the dashboard is a Durham County resident in Durham. So what we're hoping to do in the future is be able to show all Durham County residents, no matter where in the state, that they got the vaccine. We just don't have access to that data right now. So right now it's just Durham County residents in Durham County.
Awesome.
I'll just add, it is a vaccine without borders, and you literally can go anywhere. If you can get an appointment, you can get the vaccine. We are encouraged not to turn anybody away. However, I will say that state of North Carolina, Department of Health and Human Services has kind of mandated that this vaccine is for North Carolinians, because we've been finding border states have been kind of coming in, and then there's also been some frequent flyers. So for the most part, they do want this vaccine to be for North Carolinians.
Awesome. We will do one last question. I know we're right at 7 o'clock. We'll do one more and then get you guys' final thoughts and comments, if you don't mind staying on maybe 7:02, 7:03. Kind of a question, a comment, someone's asking about schools and vaccinating teachers. So I guess, Rod, I would love if you can kind of update us on where we are in the vaccination or planning for vaccinating teachers. As you mentioned, Governor is opening it up to teachers starting February 24th. So we'd love to know what the health department's doing.
Actually, prior to the governor and Secretary Cohen making their announcement, Durham has already been planning. We were in touch with Dr. Pascal Mabenga and his team, and they have formed a team to determine how best to vaccinate the teachers. This is something that we want, but again, it's important for us to be true public health professionals and say that the CDC had come out with guidelines for reopening schools. And if you follow the science and you follow the proper public health mitigation tools, you will notice that in that guidance, vaccination is actually the last thing that they recommend. Now, nonetheless, we want our teachers to be vaccinated. We are proactively doing everything that we can. It's important that we provide the proper messaging, and that is, vaccine is very limited right now. So it will take a while, but we have a plan in place. We're working directly with the schools, Durham Public Schools. They are surveying those teachers who are interested in the vaccine. They're also surveying teachers who may have already gotten the vaccine, who may have already scheduled an appointment at other counties, because again, this is a vaccine without borders. So we hope to be able to step off properly on the 24th and be able to vaccinate the teachers. My staff and I have dedicated a certain set aside for this endeavor. But make no mistake about it, it's going to take a while, because not only is it teachers, it's bus drivers, it's cafeteria staff, and more importantly, it's charter schools, it's private schools, and it's also daycare, child care centers. So it's a lot of people. We're talking anywhere from 8,000 to 9,000 people who encompass phase 3, group 1. And then I want to say on March the 10th, we're going to phase 3, group 2. So, it's a tall undertaking, but we're going to do the very best we can. And I'm very optimistic that there's going to be more vaccine to flood the market within the next 4 to 6 weeks.
Thank you. That is most of our questions. I try to get to most of the vaccine related questions. And we are at 7:01, so we'd love to get kind of final comments from all of you. Let's see, we started with Rod and ended with Ms. Williams for introduction. So we're going to go backward this time, and we'll let Ms. Williams go first for anything else she'd like to share.
First of all, I'd like to thank everyone for the opportunity to participate this evening. Every time I participate in one of these forums, I learn something, and I have done that this evening. If nothing else, I want to leave everyone with the message that we feel the vaccine is safe, and it's imperative that our community participate and take the vaccine so we all can have herd immunity and get back to our lives, and that we can all be healthy. And so I've enjoyed the conversation. And again, thank you for having me this evening.
Thank you so much. Don't leave us yet. I have some final comments for you all as well. Who's next? Dr. Wilder.
Yeah, thank you all so much for organizing this, and it's certainly an honor to sort of share the panel with all of you. I want to really sort of thank Director Jenkins and the team here for the efforts you guys have put in for Durham. I think there are a number of reasons why Durham has done well, and you guys are one of the main ones. And so it certainly is encouraging to know that you guys are our leaders, and that Director Jenkins, you're going to be leading us through this. And so thank you all so much for the effort you've done. I really hope that as a community, we begin to engage the health system around getting vaccinated, and that, push us in the health sector, please. We as a health system at Duke and UNC and Wake Med, we need to be more proactive in engaging in the Black community. So please reach out to us, help us do a better job of that. And I just encourage everyone to get vaccinated. Please do. It really is safe, and it is good for the community. It is good for you, and it's good for your family.
Thank you so much. Marissa, you are next.
Yeah, I think I'm going to echo what's already been said. It's been great to serve on this panel with everyone on it and learn and discuss this really important topic. And so I think my takeaway message is that, just encouraged to take the vaccine. And so when you're eligible, when it's your turn, to please go ahead and take the vaccine, and also talk to other people in your life about the vaccine. Just, help them find accurate information, and just share your experience when you do take the vaccine, how you felt, and just encourage them as well. And just want to leave it with that, we have a lot of assets, great assets in Durham. So leveraging those to really help the Black community, to reach out and to encourage people to take the vaccine when it's their turn.
Thank you so much. And last but not least, our health director.
Just thankful to be on this panel, thankful to be amongst such esteemed professionals, very grateful for my staff, particularly under the direction of PIO, Dr. Alicia Smith, for putting this together. There's a lot of coordination, a lot of hard work went into putting this together. So definitely want to give her flowers while I can. Great to be, share this virtual stage. I think I shared a real stage with Ms. Faye Williams at St. Joseph's AME Church a couple of weeks ago, and proud to say that I'll be back there on Saturday for a follow-up. And of course, you know, Dr. Wilder is a homeboy. We both share that Charleston tradition together. But, you know, I just want to end by saying, you know, don't sit on the sidelines. Fight for this thing. This is a right. This is a free federally funded vaccine that is yours for the taking. Don't sit there. When they say that you have a spot to take your shot, it is not just a slogan. It sounds catchy, but it's for real. And you need to take advantage of it. Fight for this thing, because too many people are still dying, way over 400,000. You know, it's not a hoax. It never was a hoax. It's for real. And again, every Friday, I keep saying a couple of catchphrases, but the main thing I want to leave you with is we can do this, Durham. We can do this, Durham. And we are doing it. And I just look forward to the day when I say, we did this, Durham. But the only way that we can say that is to get the vaccine.
Well, thank you all so much. You cannot see the Facebook comments, but you all have gotten excellent feedback. Everyone really appreciates your leadership and for taking the time to do this tonight. No one has time these days. I mean, I'm at the health department with Rod and Marissa, and we work all the time, every day. And at Duke, of course, they're providing vaccinations as well. Dr. Wilder is, I mean, you saw how many questions he got tonight. I'm sure that is his life. And Ms. Williams came out of retirement to help with the COVID response. So everyone here is just wildly important to this process, and so much appreciated. So thank you all. I will share this video on our Facebook and YouTube afterward for those who only saw part of it. And for those who would like to stay up to date, we have our emails listserv, and you can get this video. I will share information about that in the comments when I share this. So I hope this was informative for our audience, and I know for me it was an excellent hour. So thank you all again, and I think that's going to wrap us up for tonight. Thank you.
Good night.